A very good morning. I am Anuska, Verma, Assistant Professor from Rama University, standing in front of you to present my topic, diabetes mellitus. First of all, we will study about what is diabetes. Diabetes is a metabolic disorder in which there is a high level of sugar in the blood, condition known as hyperglycemia, or we can call as diabetes. Basically, what is diabetes? Diabetes is when in the blood there is excess amount of glucose, that is called as diabetes. Next, what we will study in diabetes mellitus next is what is diabetes insipidus. As we know, a hormone present in the nephron at the part of DCT called ADH, which is activated during the urine formation process, reabsorb water, but in case of diabetes, this hormone deactivates. At that time, the amount of urine increases. So basically what happens in diabetes insipidus, the antidiuretic hormone that reabsorbs the water from the urine get deactivated. Because of deactivation, the amount of urine increases because the antidiuretic hormone that reabsorb the water is not working properly or get deactivated. Now let's come to the main topic, what is diabetes mellitus. As we all know, it is a chronic metabolic disorder that is due to the because of the high level of sugar in the blood. Let's summarize it with an example. So whenever we eat something, the carbohydrate, after the digestion, the carbohydrate get converted into glucose. That glucose moves in the blood cells and distributed throughout the body. Basically, when in the blood vessels the glucose level is high, basically two conditions occur. First, either the level of glucose will be high or the glucose level will be low. If in case the blood sugar level is high, the beta cells in the pancreas will release insulin, which activate the blood cells to get the glucose to work as an energy source, which is stored in the formation of glycogen in the liver. And in case of low level of glucose, the alpha cells of pancreas secrete glucagon, which stimulate the formation of glycogen into the glucose. So it will raise the formation of glucose. Next, we will come to the types of diabetes, that is type 1 diabetes and type 2 diabetes mellitus. Basically, what is type 1 diabetes? Type 1 diabetes is insulin dependent diabetes mellitus and type 2 is non-insulin dependent diabetes mellitus. First of all, we will study about type 1 diabetes mellitus. So what is type 1 diabetes mellitus? In type 1 diabetes mellitus, the beta cells of pancreas fail to produce enough insulin. This is type 1 diabetes mellitus. And in type 2, the beta cells of pancreas produce insulin, but the body cells get resistant to the glucose. So that's why, or we can say the receptor through which the insulin bind get defunction or deactivate. So that's why the body cells are unable to take the glucose as an energy source. Next, we come on the treatment. So basically, treatment is divided into two parts. First is type 1 diabetes mellitus and type 2. As we all know, type 1 is insulin dependent diabetes mellitus, or we can say juvenile diabetes mellitus. Okay. So basically, as we have already studied, in type 1, beta cells are unable to produce the insulin, so we have to take insulin externally. For taking insulin externally, there are some insulin, that is rapid acting insulin, short acting insulins, intermediate and long acting insulins. So first of all, let's see the examples of long acting. So long acting insulin are insulin ghrelin, insulin detemir, and the rapid acting insulins are insulin aspartate, insulin liprose. Because these insulins are peptide molecules, so they get degraded in the GIT. So that's why we basically take these insulin either subcutaneously or intramuscularly. Next, we come on to type 2, that is non-insulin dependent diabetes mellitus. So for the treatment of non-insulin dependent diabetes mellitus, as we have studied, the beta cells of pancreas produce insulin, but the body cells are not unable to take the glucose as an energy source. So for this, we take some oral anti-diabetic drugs. That is, first class of drug is that enhance the insulin secretion, in which we will study about sulfonylurea. The drugs are tolbutamide, glipizide, Next meglitinide, that is dapiglutide and natiglutinides. Next DPP4. DPP4 is dipeptidyl peptidase 4 inhibitors, that is setaglutinides and sexaglutinide. Next come to category, that is overcome insulin resistance. The first is biguanide. In this we will study only one drug, that is metformin. Next is thiazolidinedione, that is prosigiltazones. And last one is the miscellaneous one, in which we will study about alpha glucosidase enzyme, in which the drug is acarbose maglitol. Next we will study about sodium glucose co-transporter, in which we will study about the drug dapagliflozin. So next start with the first class of drug that enhances the insulin secretion, in which we will first study about the sulfonylurea and meglitinide mechanism of action. So let's start with mechanism of anti-diabetic drugs. Before starting the mechanism, let's study about the basic concept behind the how the anti-diabetic drug basically works. In this, let's see, this is our blood vessels. Okay, in the blood vessels we have three things. First is glucose, blood cells. Next is glucose and insulin. Okay, as we all know, the receptor for the insulin is tetrameric tyrosine kinase linked receptor. Okay, as we all know, the receptor for the insulin is tetrameric tyrosine kinase linked receptor. So basically what happens, whenever insulin molecules bind to the alpha subunit, okay, this activate the beta subunit, and after the activation of beta subunit, there is a phosphorylation. Okay, phosphorylation occur, and with the cascade of formation, there is a transporter, that here is a transporter come on the surface of the insulin, that is GLUT4. GLUT4. What is this GLUT4? GLUT4 basically works for taking the glucose molecules from the blood cells into the body cells. This glucose enters the body cells and works as an energy source. Okay. Now, first of all, now let's come on to the mechanism. First of all, we will study about sulfonylurea and meglitinide mechanism. So what is the mechanism of sulfonylurea and meglitinide? Basically we know that these class of drug increases the insulin secretion. How they increases the insulin secretion? Basically first after the in the beta cells of pancreas, after glucose metabolism, ATP is produced. What happens in mode of action of sulfonyl meglitinide in beta cells? After the glucose metabolism, what is produced? ATP. That ATP do what? That ATP opens the ATP sensitive potassium channels. Beta cells of pancreas after glucose metabolism produce ATP. These ATP opens the ATP sensitive potassium channels, from which potassium moves out of the cell. Potassium moves out of the cell. So basically these sulfonylurea class of drug and meglitinide class of drug basically do what? Inhibit the movement of potassium out of the cell. Okay, these class of drug basically inhibit this. the movement of potassium out of the cell. This class of drug inhibit the movement of potassium out of the cell. So what happens? The potassium remains inside the blood cells. After the potassium remains inside the blood cells, the depolarization occurs, and the depolarization causes calcium channel opening, and the calcium channel intracellularly increases the insulin secretion. This is the mechanism of sulfonylurea and maglitide. Next we come on to the mechanism of DPP4. DPP4 is what? Dipeptidal 4 inhibitors. In this, for example, we have eaten something, okay, and after digestion in small intestine, two things are produced. First is incretins, and next one is GLP-1. What is GLP-1? Glucagon-like peptide 1. So basically, after we eat something, after the digestion in the small intestine, two things are produced: insulin, incretins, and GLP-1, that is glucagon-like peptide 1. So basically, they both increases the insulin secretion, increases insulin secretion, inhibit glucagon secretion. What work does incretin and GLP-1 do? Increases insulin secretion and decreases glucagon secretion. But in some cases, these incretins and GLP-1 glucagon-like peptide 1 get breakdown into get breakdowns. So basically, in the presence of enzyme DPP4, in presence of this enzyme, this GLP-1 and incretin get breakdown. So basically, the DPP4 inhibitors drug do what? Basically inhibit this enzyme and inhibit the conversion of GLP-1 and incretin into basically inhibits its breakdown. In these both things breakdown, basically DPP4 inhibits. Next we come on to next drug, that is biguanide, that is metformin. What basically metformin do? Metformin basically overcome the insulin resistance. Metformin work is basically increases the glucose uptake, and next increases the glycogenesis. Okay, basically what metformin do? Increases the glucose uptake by the body cells and increases glycogenolysis. Okay. Next and the last drug is alpha glucosidase inhibitor. So basically in this what happens? One thing is oligosaccharides get converted into monosaccharide in presence of enzyme this alpha glucosidase. Oligosaccharide get converted into monosaccharide in the presence of alpha glucosidase enzyme. So basically the class of drug in alpha glucosidase inhibitors inhibit this enzyme and prevent the conversion of oligosaccharides into monosaccharides that when get absorbed in the blood causes postprandial hyperglycemia condition. So basically alpha glucosidase inhibitors inhibit the alpha glucosidase and break down the conversion of oligosaccharides to monosaccharides. And the last drug is our sodium glucose to co-transporters. As we all know, the glucose is absorbed in glomerulus the glucose is filtered to glomerulus and reaches to PCT. Okay. So in PCT basically what happens? In PCT the glucose is reabsorbed with the help of which? Glucose co-transporter. With the help of this transporter, the glucose is reabsorbed. Okay. So basically glucose sodium glucose co-transporters 2 inhibitors basically inhibit this and break down the reabsorption of this glucose. Okay, so in this the drug are dapagliflozins. Okay, so this is all about the diabetes and its anti-diabetic drugs and its mechanism. Thank you.